neuroscience, medical school, and non-psychiatry training. So there's like a mental health component to my life that's very professional, but I think that there's also a side to it that is personal. First time I had a panic attack, I was 20. Literally 20.
Wow. Just in time for this podcast.
Yeah. When I started at Duke, there was a professor or a dean, and he said, coming to Duke is like coming to a toy store. There's all these bright, shiny objects, all these amazing classes, clubs, activities, friend groups. It's a highly stimulating environment with possibilities.
Yeah.
But possibilities, they're exciting, but you also need to commit to something to really feel the full journey of a possibility. I sat myself down and I asked myself, like, what matters to you? And where do you want to build depth and knowledge and experience?
So this is Dr. Gabby Asturias, and she is co-founder and COO of MiResource. She's also at Stanford right now, and I don't know the official title of what it is you do, but it's very important and cool.
I am a psychiatry resident at Stanford, finishing my first year.
She's a cool gal.
Yeah.
We're super excited to be
very
speaking
smart.
with her.
Yeah.
She's smart. Actually, we just recently filmed with another guest today, and they were asking us about, who's your next guest and who are you talking to? And we were telling them about Gabby, like, oh, wow, that was really cool.
Yeah, that's really smart.
Can you film
really
some questions for me, for the psychiatrist?
Yeah, exactly. Thank you so much for coming on.
Thank you
so much.
Thank you for having me.
Yeah.
She had a full day today at Stanford working with patients, so she's a
she had a
superhero.
full shift. And for everyone listening, I'm Ava. I'm Elle.
And I'm Madison.
And this is the 20-something playbook.
Yeah, so Dr. Gabby, you are at the back end of your 20s.
Yeah.
If you were to describe your 20s in 3 words, what would they be and why?
I think they would be dreams. They would be love and playful.
Oh, I like those.
That's really lovely.
Yeah, we haven't got any of those yet. I like that.
I'm glad.
Some people have been like chaotic,
drunk.
I have positive rosy glasses, I think, when I look back.
Yeah.
So maybe that's why.
That's good.
And you're from Guatemala originally.
Yeah, I was born and raised there.
And you're here in San Mateo, San Francisco, California. So what's that journey been like for you?
Yeah, I was born and raised in Guatemala, and my dad is Guatemalan, my mom is Puerto Rican. So I was this American born outside that did not feel American.
Right.
Still doesn't feel American. Yeah. But I had this, ability to be able to come. And when I was a teenager, I really wanted to study neuroscience. And there's no neuroscience degree in my home country.
Really?
And so I just started Googling like neuroscience programs. And neuroscience is pretty newish. It's getting more advanced now, but there's not a career, like it's not easy to study everywhere. But the US has a lot of neuroscience programs, and so that's how I ended up at Duke. And I've been in the US since then.
Was that your first time in the US?
It wasn't my first time visiting, but it was my first time living.
Yeah. Which is insane.
Yeah, what was that like? Like, did you feel homesick? Like,
So homesick.
Oh my God.
The first 6 months were really hard.
Yeah.
Because it's subtleties, right? Like in Guatemala, people say hi to you in the elevator, hi and bye. Every floor they get on and on. But it somehow is part of life to be acknowledging other people's existence as you're walking in a building. And I don't know, this friendliness was part of my day to day. And the US is a little bit more kind of keep your head down when you're in the bus or in like common areas. And so I think that part was striking to me when I moved here. Also Sundays were big family days. But being at Duke and not really having family, Sunday was big, go to the library for 8 hours a day.
Oh my God.
So it was like an adjustment. And I think family is a big balance. And I had family dinner every night. And now suddenly I didn't have that. So you have to build a whole new family, I guess, and balance.
What advice would you give to someone who is in college, away from home? Because it seems like now you have such a beautiful group of friends that are very lovely and amazing. How did you cultivate that group of people around you?
I think you start cultivating it naturally by finding people who share similar either upbringing or background or interests. But I do think the main advice I would give is like put yourself out there and definitely definitely when you move to a new place, like follow up with people you connected with, reach out, try to see them a couple times, because bonds take time to form.
So true.
And for bonds to form, you have to have shared experience more than just a conversation, right? And so the more you do things with other people, the more those bonds deepen, and the more comfortable you will feel in a new place.
Yeah.
And the more you can create this family concept. And I would say that I think my first 6 months were hard, and I had a really good relationship with my roommate and another friend who lived down the hall. They're both from Latin America. And with them, I had like a mini family, but slowly that also was expanded, and I met more people. And I think the U.S. has become my home because of the people who I've met and who are still in my life.
Exactly. And you work for MiResource, which we're very familiar with.
She co-founded.
Exactly. Work with.
Girl, co-founded.
Yeah, co-founded. Could you tell the audience a bit about it?
So MiResource is a startup that helps connect people to mental health. It started while Mackenzie and I were at Duke. I think it makes sense that we started with universities because it's what we were familiar with and what we were frustrated by. It was really hard to find care. Even personally, I went through some anxiety, panic attacks for the first time when I was at Duke. And I think I didn't have enough knowledge about mental health and just figuring out how to navigate getting care for the first time in the U.S. And even for somebody who has been in the U.S. but being in a new state, in a new place, it's just very scary. And I think from my end, that is why what we were doing was so important. I think it's important for people who are going through something to have easy access to care. It started that way, and it's expanded and become something larger. And we're trying to help people through their health plans or through other institutions connect with care. And so kind of the general mission is whenever you need it, we want to be there for you and help you navigate the mental health system.
We love that. I'm a huge fan of
we love
genuinely. No, seriously. I've from the beginning, I've just always loved, I've respected so much.
Yeah. And, finding the right mental health care is so important. What role has mental health care played in your 20s?
Yeah, that's a good question. Well, I'm studying psychiatry. I'm preparing to be a psychiatrist. So there's that component of it. I did neuroscience, medical school, non-psychiatry training. So there's like a mental health component to my life that's very professional, but I think that there's also a side to it that is personal. And I would say even from relatives or friends who've gone through severe mental illness. And then personally, I've definitely gone through my fair share. So I feel like throughout my 20s, I've gotten to experience there's three sides of it. And I would say, the first time I had a panic attack, I was 20, literally 20.
Wow. Nice and early.
Just in time for this podcast.
It is. It's time. And it's so scary. I didn't know what was happening. I got kind of lost on campus as I was because I was going to class and I just had this, now I know it was a panic attack. In the moment, I just felt really dizzy. My heart was racing. And I suddenly forgot what I was supposed to do or where I was going. And I didn't know what was happening. And I had to lie down and kind of get my brain to organize itself. And it was a pretty scary experience, I think, because I think as somebody who had aspired to come to the U.S. and be pre-med, I had my fair share of anxiety. Well, anyone can have anxiety, honestly.
But it's a high pressure program that you're in.
Yes, it is. Was that your first experience with mental health?
I would say personally, that was my first experience where I actually sought out mental health care. Growing up, especially in a country like Guatemala, I didn't actually know what a psychiatrist did. Which is insane because I wanted to do neuroscience and medicine and came to the US and I was like, whatever I do in medicine has to be a specialty that helps people's mind. But I thought that it was neurology. I didn't know that there was something this sounds so ignorant knowing that I've dedicated my life to this now. But I didn't know. And when I was 18 and my first semester at Duke, I learned what actually psychiatry does. And then I was like, oh my gosh, they invented the profession that I wish, when I was dreaming of what I wanted to do with my life.
That's so cool.
This is what I wanted to do with my life.
So you actually discovered it as you were in school.
That's great.
like doing an assignment for a neuroscience class. I was in the library and then I kept reading psychiatry and I was like, but what do they actually do?
Yeah.
And I was like looking it up and I was like, oh my gosh, this is what I want to do with my life.
Wow.
And I cold emailed the head of psychiatry back then.
Oh my God.
I can't, and looking back at him, I like literally just said, hi, I'm from Guatemala. I just started at Duke. I think I want to be a psychiatrist. Can I learn from you? This is such a
That's amazing, though.
Like,
I
but
love
that takes
Experience.
bravery.
Yeah, no, that's good.
I don't know. I didn't think it through that much. You know, I wonder if it's bravery or naive, but either way, she responded and was my mentor for 4 years.
That's amazing.
That's amazing.
Yeah. So, you know, life works out like that sometimes.
Yeah.
So that would be my first like intellectual experience with psychiatry. But then personally it would be when I was 20 and I had a panic attack.
Yeah.
And I said, wow, now I understand why people talk about
I get it. This
doesn't
feel good. How did you deal with the panic attacks when you were 20? Like what, do you have any like tips?
Yeah, because a lot of times, like I know when I experienced my first panic attack, you have no idea what's going on. Like I remember thinking to myself, like, am I having a heart attack? Like, is there something physically wrong with me right now?
Yeah, I definitely thought something physically was wrong with me. I kind of just sat down in a grass and I was like, okay, I'm not going to go to class. When I remembered I was going to class. And then I kind of, I don't remember. I just was breathing and trying to calm down.
Yeah.
And then I went to student health. Yeah. And then they started me on some medication, but I didn't have that much experience or knowledge about it.
Yeah.
And they referred me to psychiatry. It took a while to be seen, which is why I'm also passionate about students connecting
MiResource came into play.
because no one really evaluated me.
Yeah.
They just said, oh, it sounds like you have anxiety. But it was like a quick 20-minute visit, which I understand, you know, this happens with primary care and we need primary care providers to do this because psychiatrists are in, you know, there's not enough for the demand. So I understand why things played out that way. And they started me on Lexapro. And I remember I actually, you know, so then I went to a psychiatrist who evaluated me and then I was actually taken off of it. And we did other like behavioral things and therapy and that actually ended up helping correct kind of the level of anxiety I was going through.
Really?
And I think medication is really important and it is an important part of people's journey. In my particular experience with Lexapro, it was just making me, the brain fog was really heavy and I couldn't really get through my schoolwork. That was the main reason I stopped taking it.
Yeah.
But I was very thankful that I got the right behavioral strategies.
Right.
And I haven't had that many panic attacks in my life since. So it's been mostly about managing anxiety. And we can talk about more because I've had other experiences.
Tell us.
Let's lay it all out on the table here.
Well, later in my 20s, I did burn out. And I've since then learned a lot about burnout. Because I think people use it colloquially a lot.
Yes.
And it's, you know, in general, psychiatric terms are used colloquially all the time. Like people say my OCD and you're like, what do you mean?
Like, you're not.
Or they say something's traumatic and you're like,
what does what does trauma mean for you? You know, and you can't tell people what their experience is like, but sometimes when we use certain terminology that describes other people's experience that might be a little more severe, it can cause difficulty communicating.
Exactly.
Because at the end of the day, these are just words to enable communication between patients, providers, and between providers also. So I think I had burnout that then led to a real depression later on, like while I was in medical school. And I think it's hard because as you're burning out, like as you're going through the phases of
fire's
burnout, dying. You get adjusted to a new baseline. And I don't think you realize that you're in a new baseline. It's true. It's not until you like really go far from what you were before that you're like, wait a minute, something is going on. And I did seek care at Stanford. So I have two experiences, I guess, Duke Counseling Center, Stanford Counseling Center. I was thankful that at Stanford Medical School, we have dedicated mental health resources for the med students. So it's pretty quick turnaround to see somebody.
That's good.
That's good.
Yeah, and I'm doing great now.
And
Good. I've been feeling great for the last few years, but it was definitely part of my story.
And how do you navigate, you know, being a co-founder of a startup and being in Stanford, like how do you navigate? How are you doing it?
The burnout, I understand now.
Can you lay out what your week looks like? How do you balance that?
You know, I think something about burden or workload. How much are you doing in a day? As you become older, as I went through my 20s, I mean, I started a lot of these things pretty early in my 20s. So I've had high workload for a while. And I think the more you go through experiences and you realize you survive them, the less anxiety provoking they become.
It's true.
So I would say peak of my anxiety was truly like undergrad, because it's when we started co-founding this, when I was doing a lot of big new things where I had a lot of responsibility. And I also have some work in Guatemala, and I was responsible for payroll and like things that,
Oh my God.
you know, when I was in my like 19, 20, 21. And I think during those years, I had a lot of anxiety because a lot was new.
Exactly.
But after that, some challenges are no longer as anxiety provoking because you have a memory of, I survived this.
You've experienced
it, and you're like, well, this was hard, but I worked through it, and so you can kind of reason through it, and like that's very calming. So I would say definitely like the concept of balancing between like a job and going through my medical school degree and now residency. It's something that I've done for so long now. I mean, I ended up doing 6 years of med school because I did some part-time work while I was finishing school, which also helped balance. Obviously. But, you know, I don't know. I just think I got used to it. It's very easy for me to context switch. So I'm very organized with my schedule. I live by my schedule so that I don't disappoint any of my two. I try not to disappoint any of my two responsibilities. I definitely think that as you keep going through your 20s, there'll be new experiences that are anxiety provoking. So that never really stops.
I feel like that's life.
That's life. But some things that were very scary when I was 20 that I experienced some things very early on that not anxiety provoking.
Well, I always use the example of like calls, like Zoom calls. When I got out of high school, like
terrifying.
I always say like exactly.
And terrifying.
And also like, you know, working for Team, the nonprofit with Mackenzie, we kind of got used to being on Zoom calls. That kind of got me comfortable with it. But then I got comfortable there, and then it was like, and then when you do Zoom calls with people you've never met before, it's like that was a new level of anxiety. But then after did those for a while, it's like, okay, like I'm comfortable with that now. And then, you know, like you just kind of build your experience from there, and things aren't so anxiety provoking anymore.
And sorry, a little bit of a pivot, but to go back to what you're saying about burnout, what action steps do you take right now to make sure you don't burn out again?
Yeah, I think couple things. Definitely what tipped it over for me was a new experience. It was the STEP exams, which are very famous, I guess, because they're like the standardized testing we have to go through to get our medical license. So there's 3 of those. And the first one, I got very ill with COVID, so I had to delay it a long time. And when I was scheduled to take it, I was very far out from the preclinical coursework that you need in order to take the exam. So I think that was very anxiety provoking, and that kind of tipped me over to being less balanced in my life. And like compromising on things that I used to do to help me prevent burnout in order to pass this exam. And then I was too far deep into the unbalanced routine when I was already like all the way through burnout, and I didn't fully realize. So I think one of the things I always tell people is like things compound, you know, and as I've gone through my 20s, I've learned what works for me. And I know that when I stop doing those things, I can stop it for a day or two. You know, some days getting crazy, but if you stop it for more than a week, I know that it compounds for me, and it can set me down a path that I don't want to go down. And it'll be worse for me down the line. So definitely sleep. I'm very strict about sleep and very good about like making sure I try to sleep 8 hours. I would say even in residency, I'm at least averaging 7, but sometimes I get the full 8.5 sometimes. 6 the worst days, but you know, I try really hard to hit a good average, and I track it very religiously. Balanced diet as well, and just making sure I'm eating, not starving myself, hydrating. I know everyone says these things, but I'm very focused on it because I think otherwise you can't run, you can't function without taking care of yourself. And then there's 2 big things for me. One is exercise, even if it's 30 minutes, even if it's walking down the hospital and like talking with the attending, just doing something to get you moving. Because being in a desk, and this happens so much to us now with remote work.
Oh my God.
Even me that I don't do remote work, I'm at the hospital. We still sit a lot, and we don't move as much as we need to. So movement, at least 30 minutes, very important. And then I love reading, and I had forgotten that.
I think I did too.
And I remembered.
Like, yay.
Are you you a fiction reader or all nonfiction?
Fiction reading.
Me too.
Yeah, we're into that
I always
too.
joke, like, we've been talking with a lot of people on this podcast and it's all self-help books, which is really great. But I'm like, I love my fiction. I love a good murder mystery.
100%.
And it sounds counterintuitive, but murder mysteries make me feel more at peace. Like, I love them.
Definitely. Because self-help feels like an instruction manual
Yes.
that you then have to put work into to make those changes.
It feels like more work.
Yes.
I
So
say
I'm
that
a
all
big
the time.
believer in like you have to do activities that don't feel like they're adding more work. Yeah. They're just letting you relax.
Exactly.
And I think there was a part of my life, maybe like transition from undergrad to med school, where I was like, oh, I'm older now. I should stop reading like fun fiction books. I have to be reading this literature or whatever. And I was forcing myself to do that. But
I know.
But then your brain does something else, right? So then you're
Yeah.
scrolling, which is honestly pointless.
I know.
But I don't scroll anymore.
That's amazing.
Yeah,
No,
no, that's
I
what we do that all the
Yeah.
time. We're like, we'll literally all be eating lunch together, and sometimes I'll catch myself scrolling, and she'll be reading, like Ava, and I'll be like, oh, like I need to put this phone down, and I can just read.
About
It's way
3
better.
years ago, I got a Kindle, and it's made
the best.
Oh, it's so easy. It's like even on
so
this
good.
trip, it's like I finished a book, I download another one. It takes 2 seconds, then I'm reading again.
What fiction books are you reading?
Well, I became a bit of an obsession. So I read 100 last year.
Oh my god!
I need your to be read.
Okay.
So I have a deep list of fiction.
We'll
But I'm
talk
very
about
like
that.
I like to read according to mood. So I have this like wish list of things that I want to think about.
Yeah.
So I'm pretty versatile. So I read like fantasy fiction or
Yeah.
more realistic, like rom-com
Yeah.
or like
Gotta
breakup
mix it
even.
in. Yeah.
Or
Ooh, heartbreak.
or just like mystery, or I have all
Yeah.
my like lists.
Yeah.
And I'm like, how am I feeling? And then I like
I do the
dive
same
into a
That's
thing.
awesome.
We're the same.
emotion driven reader.
Yeah, same.
I feel like for me, like again, it sounds silly, but for me that helps me read more because like
Yes,
if I'm in the mood
you're in
for
tune.
exactly
Yes,
like
yes.
if I'm in the mood for like an intense mystery where I'm like I need to be like stimulated and thinking, then I'll read a mystery. But if I'm like I just need to feel like calm and happy, I'll read a rom-com.
Yeah, you want things to end well.
Exactly.
Yeah, right.
You just want to.
I
know.
want hope and happiness in the end.
I've been reading a mystery series recently, and it's about serial killers, which I find very interesting. But it's like, but it's like I'm on the 4th book now, and I'm getting to the point of like I need to stop reading about murderers.
You can take a break.
Yeah,
And then
I'm
circle back.
almost on the
It's time
4th
to transition
one.
into the happy stuff.
Literally 2 days ago, downloaded a rom-com because I was like, I need to just like.
Which one did you
calm
download?
down. It's called Boys of Tommen. Have you heard
Oh,
of
I
it?
have not heard of
It's
it.
an Irish story. Apparently, it's very good, and apparently has like a bit of depth. Like it's not like super. Like I do love the flaky rom-coms, but apparently it has a bit more depth.
More death.
It actually has some mental health in it. But
I find my Dove in all books. I'm like, why is everything so bad? I need a break from
I hate
I
to
need to
say it. I
escape
hate to say it, but sometimes when I read something that I'm like, there's mental health because we also work with a nonprofit.
Yeah.
It's not nearly as involved as you
Yeah,
are.
no, not nearly.
But
Yeah.
sometimes
You're
I'm like,
psychoanalyzing all the characters, probably.
yeah. But
try
even
not
me,
to. I'm
yeah.
just like, I just want to be a passenger.
Like, please.
Even me, sometimes I'm like, if there's a mental health, I'm like, I don't know if I'm ready for that
Well,
right
there's a bit
now.
of psychology in writing. Like we're all
Yes.
screenwriters.
Maybe that's why.
Yeah.
no,
I
there
love
is.
it.
Yeah,
that's
There's
true.
a little piece of your brain that's like this. Is
No,
I
it's
get
true.
this.
Writing is like huge about characters and psychology.
Yes.
I wanted to ask you, for someone feeling lost in their 20s, what's the first step you'd recommend they take?
I would say take some time to just think about what matters to you most.
Yeah.
Something I did when I was 18, so it's a little earlier, but it
Yeah.
marked my entire 20s.
Yeah.
When I started at Duke, there was, I don't remember who said this, it was a professor or a dean, and he said, coming to Duke is like coming to a toy store. There's all these bright, shiny objects, all these amazing classes, clubs, activities, friend groups. It's a highly stimulating environment with possibilities.
Yeah.
But possibilities, you know, they're exciting, but you also need to commit to something to really feel the full journey of a possibility. And I didn't want to be somebody who was pulled in every direction because I tend to get excited about a lot of things.
Yeah.
So I sat myself down and I asked myself, like, what matters to you? And where do you want to build depth and knowledge and experience?
Yeah.
And that's actually when I defined that I wanted to dedicate my life to mental health.
Yeah.
And I said mental health and then anything that can contribute to the Latino community, Guatemala obviously being super close to my heart.
Yeah.
And these were like my 2 filters. And I wrote it down. And then when things would come up, I said, do they fit any of these 2 filters?
Yeah.
Eventually they became a little bit more elaborate. And I every year try to like at some point in the year, I tend to do it around New Year's, just reflect like, what do I want to work on this year? And I use that as a filter to say no to things.
Yeah.
But even before my 20s, I was trying to think like, what do I want to do? Because I do believe it's good to change things and try different things.
Yeah.
But I also believe depth is sometimes forgotten how important that is. Obviously in medicine, we have a lot of depth.
I was going to say, you're definitely depth.
But I think even if you want to make an impact in mental health, like I felt like this is what I want to do with my life.
Yeah.
For me, it wasn't, this is just my degree or just this is my career. I want to choose something for my life. And a lot of the work that I've done is always thinking about what do I want to do with my life. And so it's been, I think that's made it also easier to go through delayed gratification of, med school and residency, because I know that the steps I'm taking are towards the life goal that I have, not just towards a short-term or medium-term idea.
Exactly.
So that's been very helpful.
Yeah, I want to hear about what you're doing for the Latin community in mental health, because I feel like you're really taking the unity.
Yeah, I mean, at MiResource, we take into account identity a lot and ethnicity. I think it's really important. We talk a lot about the right mental health care, and I think if you don't feel comfortable with your provider or if you don't feel recognized or identified with them, it's very hard to adhere to their recommendations. Because ultimately, as doctors, and even therapists, we're telling you what we think based on our professional opinion. But if you don't respect or believe us, you're not going to follow it.
Yeah, exactly.
Or if you don't understand why I'm saying what I'm saying. So I think I'm a big believer that you need to understand deeply what is being told to you and why it's being recommended. And I try to incorporate that into my daily practice as a resident and as a doctor. And I think in MiResource, that's part of what we're trying to cultivate, a transparent environment where you can have all the information available to you to make decisions and seek the right care for you. And then separately from that, I'm also doing a public health training so inside of the Stanford psychiatry program, I'm part of the public health community health track. And so I get to work with immigrant communities, particularly with Latin Americans who are living in the US. And so that's been a big part of, my training. And I also want to be able to provide treatment in Spanish. It was my first language. And so I think there's not as many providers who speak Spanish in the US. So that is one of my goals and one of the things that I'm trying to do as I go through my training and in med school as well. And then I have a lot of projects also in Guatemala. We're a long ways off from establishing a effective mental health system back home, but I'm trying to support the local organizations who are doing that.
Yeah, that's amazing.
Yeah, good for you, Gabby.
Yeah.
And can you take us through like exactly what you do for MiResource? Because I've always been interested in like what those roles look like.
Yeah, I think my role is super fun because I get to think a lot about people, about how people experience what we're doing and how we can build things that make sense to people and actually add value to their lives. So I do that through a product lens and a research lens. So in the product side of things, I work with our software developers, our product manager, our designers to think through the experience we're creating for somebody. And that is everything from the content to the way a structure of the product looks like, and how many clicks and how, the entire experience. Because we want MiResource and we're trying all the time for the experience to be therapeutic in and of itself. We don't want this to feel more overwhelming. So that's what I do on the product side. And then on the research side, it's related because all the research we're doing is with technology and it's about how do we improve our technology to help people. And so we currently have a grant that we're building we're training an LLM, so basically AI, to help people figure out what's the right level of care for them. I think something that happens a lot in mental health is that we start where we can, right? Like we start having symptoms, and sometimes like the symptoms can be actually quite severe, but we're not necessarily gonna go to the highest level because if we've never had symptoms before or our parents have never had a kid or known about somebody with these symptoms, we're not going to go straight to the emergency room. So most people start with a therapist, or the lowest level of care. And that can sometimes be inappropriate because that person might need acute care, like in the moment. And sometimes getting an appointment in this country can take weeks. And so that can lead to that person getting worse, and then something happening. And, part of what I want to do is build a tool that helps people understand how they're doing in that moment, either themselves or you can use a tool with a loved one and figure out from how they're doing today and based on like past history, what do they need right now?
Yeah.
And if that right now means they need to be in the emergency room and they should spend a couple days in the hospital.
Yeah.
The hospital in this country is meant to stabilize, is meant to help resolve a crisis, is meant to get you to that stage where you're comfortable reinserting back to your community and your life.
Yeah.
And there's a lot of levels from hospital to being at home with just therapy and psychiatry that are in the middle that people don't know about unless you are a mental health provider. You know, residential treatment program, partial hospitalization. Like, what are these terms? No one knows them.
Yeah.
We don't
Yeah.
think about it in a day-to-day experience.
Yeah.
And so I think because they're so foreign, most people who might need one of these levels end up starting here. And so what we're trying to do is build a questionnaire that, based on how you're currently experiencing your life, can tell you, based on what I'm hearing, this is where I would start for you. And these are the exact resources that take your insurance and that match what you currently need right now. And then you can kind of shop around, but we took you to shop in the right bucket of resources. So that's our first study. And then our second study is, how do we help people over time? Because mental illness is, you know, you change through time, and it's not static. It's not the same all the time. And so we are looking at integrating a multimodal journaling tool and using, you know, multimodal, I mean, like you can rant audio notes.
Wow.
You can do selfie if that's a more comfortable way to express yourself. You can write, you can type, you can voice dictate, you know, whatever you want to express yourself. And the idea is that the journaling tool can then extrapolate the same what we're doing with the other LLM that's using validated clinical assessments. We want to be able to, from just journaling, be able to predict an assessment score and say, where do you need to go?
Very cool.
And we want that, more ambitiously, we want the journaling tool to kind of talk back to you and say, hey, I'm hearing that you're going through, I don't know, bullying in your school. And let's say you have an appointment in a week and you have the right care, you're already matched, but this is happening right now and it's quite distressful. Here are some tips that I've seen other people implement when they go through something like this.
That's very cool.
So more real-time interaction in between appointments. And I think the beauty of this is that it can build analytics over time. And mental health providers, we see you once every 2 weeks, once every month even. And sometimes it's hard to understand what happened between the last session and this session. And this could give a lot of insight as well to your providers and equip them to better serve you. And
that is
your goals.
incredible.
Very
So that's
smart.
what we're working towards.
Incredible.
No big deal. Okay.
Yeah, no big deal.
We're long ways off. But this is,
but do you find
insanely amazing?
No, but do you find with AI and everything progressing these days, is it making it easier to get to that goal, or is it still just as hard as it's been?
I think AI, if used responsibly, can be quite helpful for mental health. I don't think we can fully replace a person and the therapeutic relationship you can build with a mental health provider. But I will say, a lot of my job sometimes boils down to logistics. And it's really frustrating because I would like to spend my entire day in the therapeutic interventions rather than logistics. And logistics, like, where do I go? Will my insurance pay for this? How do I know when I need care? I said in my personal experience, I told you that I started burning out and didn't realize until it was kind of late. But if I had been journaling, it could have told me, like, hey, like,
you're burning out right now.
Of how your mood has been over these last 10 days is lower than the pattern before. Do you want to like engage and like, hey, I think you should see somebody. This is what your insurance would cover. Like, here are some options. So I think as humans, we're very like short term, you know, like our memory is selective and we don't fully remember how we were in the moment. And so it's very easy to not realize that you're not doing as good until you get to a certain point where it's very obvious.
It's like a breaking
people
point.
Tell you, people always talk about the breaking point or like a big like transition moment. But the reality is, it wasn't overnight. It was building. And so the hypothesis is, can we catch it? And so AI really, we're using like a technology to help you express yourself. And then what AI can do, or what we're hoping it can do, we're gonna have to train it with a lot of experts, is that it can kind of raise a flag and say, hey, let's take a pause. I think you should connect with somebody. And so I think it can serve as a bridge to help you identify when you need care. I don't think it can actually replace the care.
Exactly.
But it can raise the alarm. And honestly, mental health is all about early treatment and
Yeah,
prevention
exactly.
and preventing complications.
Yeah.
Right? And so I
Yeah.
think this is where AI can be very helpful.
Yeah,
Amazing.
that's amazing.
so
I'm
cool.
also very interested. I don't know if you can answer this because I know you're saying this is
Yeah.
kind of hypothetical, but what does that look like training the AI? Is that you? Is that people you hire? Like, what does that look like to make sure it's, I guess, psychiatrically, I'm not going to use the right term, but like it's medically
Correct.
correct?
Yeah,
if
like
I'm
clinically
saying that
sound.
right. Yeah, clinically sound. There you go. That's a way better way of saying it.
Our lingo.
Yeah, exactly.
Well, so the way we designed this study is we're going to have subjects enroll, and they're going to be doing both things, journaling and doing formal clinically validated assessments. And then the idea is we're going to have clinicians, so experts, review periodically these journaling and assessments and make recommendations of like this person should be connected to this level of care, or this person needs this kind of resource. So the idea is that we do it manually first, and that's how we train the LLM. Ideally, what we want to go towards is we're fully replacing the assessments and just using journaling.
Yeah.
So that's why I was kind of briefly speaking to, can journaling predict assessment scores? And then can we just remove those assessments? Because like answering assessment questions can be quite cumbersome and like hard to adhere to.
Yeah.
But journaling can be a little bit more natural and therapeutic in and of itself. Journaling is something people recommend, right? And so if we could just journal and with the journaling get enough data points to predict, oh, this person's like scoring this way. And because of this prior training experience, we know that someone like this would benefit from this kind of care. Then we can just recommend that care. But it takes time to do that training.
100%.
And there will be a lot of ethical and QA things that we have to observe and be very careful about.
Wow, that's amazing.
Taking it back, like this is also amazing that you're getting up to all this in your 20s. It's just the coolest thing ever.
I find it so interesting.
Yeah,
It's
me
And
too.
I'm
wonderful.
wondering because you're just up to so many amazing things, and this is kind of like a mild pivot. But did you ever have any stereotypes in your head about the 20s? Like, did you ever have a moment in your 20s where you're like, I should be at this place by now, and this is not panning out how I thought it would go?
Oh, definitely. We all do. I would say first moment of that feeling was, I think I was like 19 or 20, and I was in my lab. I did neuroscience research at Duke, and a lot of the people in my lab were men. And they were like, so what are you going to do through med school? Like, when are you going to, med school residency, like, when are you going to get married or have time to have children? I don't even know why they were bringing these questions up. But I had a total panic, and I was like, oh my gosh, how am I going to advance in my life when professionally there's all this pressure? And I think I remember calling my dad and freaking out and being like, how am I going to, do the other things you're supposed to do? Like, I guess.
Okay, how can
get
you have
married
it
or
all?
Have a family. I mean,
Yeah.
everyone can define how they want their life.
Yeah.
Not everyone has to have a family.
Yeah.
But I've always wanted to have children.
Yeah.
I've always wanted to have a family. And so I was freaking out when I was like realizing how long med school residency all these things are. And I was like, when do I have time for this? And my dad was just like, so not concerned. Because I was like, how am I going to find a partner who accepts all this work and stuff?
Right.
And he was just, he was just so, I don't remember what exactly he told me, but he said there, someone, I don't know, he was just so supportive about like somebody, you will find someone who loves you for who you are and what you're doing in the moment. And you're not going to have to change these goals to find love and to form a family. And he was so reassuring. And I remember deciding like, I'm not going to be one of those people that goes to medical school and says, I'm pausing my life. Or, you know how I think there's this feeling in medicine where you're like pausing and life will resume once you finish. But when do you finish? Do you do med school, residency? You can do a fellowship after that. Then you're an attending. You're like early in your career, finally, when you're like 30 something. So when do you start your life? You know? And I think that, I remember that day being like, no, I'm living now.
Right.
My life started already. Being a med student is part of my life. I don't have to wait until I'm a full on attending to be starting my life. And I think that shift in mindset helped me a lot kind of get over these ideas of like things have to happen at a certain moment. And then with medical school, I always thought, I have to do 4 years and then residency and everything has to be fast, no gap years because I have to start a family. And then I realized like, no, there's no rules. And I took a gap year in between undergrad and med school. Did 2 extra years of medical school. I've been working in MiResource and doing all this research. And that mattered to me. And I said, I don't want to wait 10 years to do this. I want to do this now.
Yeah.
And it's okay because my life already started.
Yeah.
And so I don't need to
You're living
postpone
it.
this.
Yeah.
So I stopped feeling this pressure that I have to finish things a certain timeline. So the same goes for marriage or starting to have a family.
Yeah. That's super helpful.
Yeah.
Because I think even I know some people in their 20s are like, oh, I will do this thing when I have this amount of money, or I'll do this thing once I've reached this certain goal in my life. And I think that's really helpful for people to hear that you're living now and this is your life now, and to just not wait for some arbitrary success to happen.
And life is very surprising.
I think the 20s is just a nice and surprising decade. I wanted to ask you though, what was your biggest, I guess, career pivot or maybe unexpected twist in your 20s? And how did you
be career?
Yeah, it can be any just unexpected twist.
Yeah, surprises.
Yeah.
Well, I would say that when I started Duke, I was like, I'm pre-med neuroscience. I declared my major first semester, even though at Duke you can declare 2 years in.
Oh my God.
So I'm like a very decided, headstrong person.
Yeah.
And so I like literally enrolled and I was like, I'm pre-med, I'm neuroscience, and I'm doing this and this, I'm committed.
Yeah.
So someone like that, I still got very surprised because my whole trajectory was I'm going to go to med school. I'm going to do all these things. And I did the research and I did everything you're supposed to do to get into med school. Starting MiResource was not part of the plan.
Yeah.
You know, I've done a lot of global health work in Guatemala. That was not part of the plan. Not necessarily. And I think these opportunities kind of presented naturally while I was at Duke. And they changed my life. And they ended up being more important than these fixed ideas I had of how my trajectory was supposed to go.
Exactly.
And it kind of, and so, it's actually a twist. And it's a twist if you compare it to my mentality back then. I was very rigid and I had to do all these things. But it's similar to the former question of like, you have to accomplish this by this age. And like 28, you have to be married, and then babies, you're in your 30s, whatever ideas, right? And I think as these opportunities came up, I realized that what's more important, I think, is to seize opportunity. Rather than like having a fixed idea of what you're supposed
trying to
be
predict
doing.
the path before it's even happened.
Because the fixed ideas can actually block opportunity.
Totally.
Yeah.
Yeah. How have you defined, because you're not in your 30s yet, how have you defined success in your 20s?
And has it changed?
Yeah, I think it has changed. I think definitely feel like at Duke, it was about getting into medical school.
Right.
It felt like such a lofty goal. And there was a lot of messaging by professors and advisors that you should be thankful to even get into one medical school. And like, there's just a lot of messaging of how hard it is. And so I think that was like my definition of success was probably very narrow and didn't really encompass much more besides getting into medical school. I think then that definition started to expand because then I took a gap year, and actually when I arrived at medical school, I had things that mattered to me as much. And initiatives that I was doing on the side. And I actually ended up choosing Stanford because they're a program that really embraces people who are different and who have a different definition of what success. It's like a very unique definition of success. And I feel like this whole time, I mean, I did medical school and residency now at Stanford. I felt completely supported, and I felt like my version of success has been celebrated throughout. And
that's amazing.
Where was I going with this? Okay, so success at first was very fixed. And then I think it became more about, am I working for causes that I believe in? So is my work in whatever stage I'm at of my career contributing to what I want to be contributing in the world? I think as I was going through preclinical training at Duke and then medical school, you're not really helping people directly, but through MiResource, I was able to do that. And so I had a whole different role where I was thinking about software and had to learn how to do this. And I felt like I was accomplishing part of my mission of what I want to ultimately do. And now that I'm finally a doctor and practicing, I get to live that also on a day-to-day basis. And then I would say recently, I would say this year, my definition of success has changed a lot. And I think Sebas, my partner, and I talk about it a lot. And I think our current shared definition of success is if you are happy to go to work and if you're happy to come home, that is success. And I truly love my jobs. I have 2 jobs, I guess. But I love both of them. And I love coming home and being with us. And so I think I've come to love the stage I'm at. And residency can be frustrating, but frustration is how you grow, I think.
That's a beautiful definition of success.
And I wanted to ask you,
what would your top tips be for any med students who are listening? Like, I don't, and this could be, mental health related, just anything that comes to your mind that could help med students, because it's a long journey.
We have a lot of other friends in med school, and it's been a journey. Actually, we had a friend recently just graduated from nursing, and it's like we've been talking to her throughout the whole thing. She's had some really rough moments.
She's had some tough times.
Delayed gratification is hard.
Yeah.
And ingrained in all the medical professions. I think what I would say is, so when I was applying to medical school, we were told that we had to answer the question, why medical school? And then when you apply to residency, you have to answer that question too. Like, why X residency? It might be psychiatry. And this feels like a stupid question at first. When I heard it, I was like, what, how am I supposed to answer? Like, duh, I want to because I want to. Right. I would encourage people to actually really think through that question, because I think if you can truly answer that for yourself, you can go through failing a test. You can go through being frustrated by standardized testing, MCAT step, all the other standardized testing you do in other medical professions are very cumbersome. But I think if you know really why you're doing this, and it has to truly be something that goes beyond the immediate term, I think that will help give you clarity and help you get through the moments where you have a lot of doubt. And I had a lot of moments of doubt. And I also think when you actually do the application process, it comes across in interviews and your essays that you thought about this and you truly want to do this. And I think for me, my biggest dream in life has been, I want to contribute to building mental health systems that support vulnerable populations, both here in the US, that is my now home, and back home in Latin America. And I feel like I've actually been able to contribute to those dreams, and I'm going to keep contributing to that. And I knew deep down that if I got an MD degree and also the authority that comes from like completing residency and all this training, I was going to truly accomplish those missions. And I think knowing that makes you push through, because there's a larger reason for why you're doing this. It's basically like, you can't just do it for, I just want to be a doctor because I have this idea.
Bigger vision and mission.
What we say in our family is you call it like your why, essentially.
Yes, your
like, why are you doing this? And if you have your why, then you can get through the difficult moments and the delayed gratification.
Because I think people
can get through all of that.
Yeah, and I think people often have this idea of like your dream job being perfect. And it's really not. But if you love it enough,
no job is going to be easy.
No. And I think it's that thing of like, if you love it enough, then the faults are worth it.
I agree.
Yeah.
And I think there's definitely days through all of the different stages I've gone through that were really rough. But I agree with you. If you ultimately know why you're there, you can keep coming back there, and you can be smiling while you're doing it, because you're ultimately doing what you want to do with your life.
Exactly.
But I think it takes a lot of introspection to define the why of your life. And it's really hard. And so I would encourage medical students, and honestly anybody, to just take time to really define this. Because I think, especially if you're high achieving and you have a lot of lofty ambitions and goals, and it's sometimes you feel like you're kind of rushing through things. This is the kind of thing you don't rush through. I think.
Have you ever struggled with patience, and what has helped you with that?
With patience?
Yeah.
Oh yeah, I'm so impatient. I think, it's interesting. I think impatience can be good when you're trying to push change, because I think sometimes being on top of something is how you change something. Like a lot of systematic change or infrastructure changes don't happen unless you pursue them, and you kind of stay there. I don't even know if that's impatience. It might just be perseverance. But,
I think they kind of go hand in hand.
But I do think that ultimately, like, patience has been a defining feature of just delayed gratification, right? I think it goes back to this idea that you can't think that your life hasn't started. You have to tell yourself, this is my life, and find joy in what you're currently doing. Because if you're unable to do that, then it truly feels like everything's on pause, and patience becomes harder, I think.
Enjoy the journey, not just the destination.
Definitely.
I feel like that's just so important.
The classic, enjoy the journey. So this is like kind of like a relationship question, but what role has relationships with friendships or with your partner played in your 20s?
That's a wonderful question. I'll start with partners.
Okay.
I think in my early 20s, I was quite fixated with the idea of going to medical school, as I've previously stated. And I think that meant that I didn't want to have partners that made me doubt that path or like made me choose a school or an option based on someone else. So I think at the beginning of my 20s, I felt like I wanted this freedom to choose where I wanted to go. Once I got to Stanford, and I think a few years into Stanford medical school, I think I got more clarity as to what I want to do with my life. And that probably just comes with experience, maturity, and more of that why introspection.
Yeah.
And I think that's when I think around 25 is when I was thinking I was ready to form, a longer term partnership with someone.
Yeah.
And, I'm currently dating my best friend from undergrad. Who's still my best friend. Yeah, truly.
Yeah. You guys are cute.
Yeah.
So when did that happen? Was that
Around
after you were 25?
Yeah.
Okay.
Yeah.
Her
I think it
mindset
happened
shift.
because I got to that level in
Yeah.
my mind.
Yeah.
He probably also went through his own process. I mean, I think you have to be ready for commitment and cultivating a relationship. And I think Sebas is a person that I would move for, somewhere else. And I mean, he's become a part of what I want for my life.
Yeah.
I think before when I envisioned my life, I envisioned somebody there, but I was more, I was trying to make it. I was trying to get to med school. I was trying to jumpstart my career. But now I feel like things are kind of moving forward, and I couldn't imagine my life without him. Yeah. And so I think you kind of have to be open to that. Yeah. And then you have to work every day to keep that.
Work on the relationship.
Yeah.
And you started out as friends too, so that I'm sure that helped with, you had a nice foundation there.
Yeah. I think friendship is the best foundation.
Yeah.
I think so too.
That's beautiful.
And I think with friends, I would say undergrad Duke was an amazing place. I have friends that are the dearest people to me.
Yeah.
But then I've also had friends that come from other stages of my life. I think the friends that become family are really important, and I would make sacrifices for. And I think also friendships is what's made the U.S. home for me. Knowing that there's all these other people that I love so much that are here has also made it easier to leave my country and truly leave it, because I don't think I'm moving back.
You're like, I'm staying here.
I am staying here.
Are your parents in Guatemala still?
Yes. But I mean, I visit a lot. I go back a lot.
Yeah.
And it's still very important to me. And I will keep working to help and just to contribute in any way I can.
Yeah.
Guatemala.
Yeah.
It's hard because I can't really practice medicine back home.
Yeah.
It's also kind of that defined things a little bit for me.
Yeah.
But I feel like I've lived here so long, and I've formed all these friendships that have made this my home, that I see myself going between both places and feeling at home in both places.
Exactly.
now.
That's amazing. Beautiful. We can finish it there. This
has
been
wonderful.
wonderful.
Thank you so much. You're so inspiring.
Yeah.
Thank you for coming to see me.
And we're gonna link everything in the show notes where you can find her, and keep track of her amazing
And
journey.
MiResource. We're gonna link MiResource for anyone. who's
Thank you,
seeking
Dr.
care.
Gabby, for
Thank you
coming.
so much.
Dr. Gabby, that was
Thank you
wonderful.
for having
We really
me.
enjoyed. Thank you for letting us invade your home.
No invasion.
All of our
Beautiful
equipment.
home.
And thank you everyone for listening.